I'm Colleen McElwain, Executive Director at Animal Health Canada. At today's forum, we heard about how Animal Health Canada helps to facilitate a forum for collaboration, coordination, and communication, and that leads to action on a number of complex issues related to animal health and welfare. We started out with some discussions about how to use artificial intelligence for disease surveillance. We then went and spoke a little bit about how our division, the Canadian Animal Health Surveillance System, functions and how it also supports some of that AI work. We then went into a presentation from Erica Charlton, our Division Director for Emergency Management, talking about how her division has been doing a number of projects related to foot and mouth disease, African swine fever, and highly pathogenic avian influenza in both poultry and dairy cattle. And then we went into a panel talking about the history of the African swine fever Executive Management Board, which was coordinated since about 2021. Tomorrow we'll be looking to hear more about the animal welfare components of the work that we do. So it'll be through the National Farm Animal Care Council. They'll have a presentation as well as one of our keynotes, Dr. Tina Wadowski, talking about some of the work she's done that supported current development. We'll also have a presentation talking about a little bit about best practice adoption from two speakers who will share a bit of information on how to get people to adopt best practices. Behavior change is always one of the components we have to think about when we develop our programs. And we'll end the day with some information from the Dean's Council, talking some of the work that they've been doing to help support animal health and welfare across Canada through a research institution perspective, and end with a panel on how to help each other in the event of an emergency for mutual aid, whether it's through agreements or training or sharing resources. I think that they would like to take away from a day like today that at the national level we are looking at some of the bigger issues that could potentially impact them directly on farm. So things like if there was an animal health emergency from a major disease, what kind of plans are in place? What has your producer associations done at the national level and the provincial level, working with different levels of government, which we facilitate. We do bring them all together. The other part is that we do consider the best practices now informed by science when it comes to development of the codes of practice for the care and handling of farm animals on farm. And we also look at some of the societal expectations to help make sure that we're meeting what we ought to be doing, as well as what the science tells us is in the best interest of our animals.